Hello, everyone, and welcome to WDHT Cares. We are with staff at Garden City Hospital on location here, and we're talking about heart health and the emergency department. And we have with us Dr. Hao Wen. I got it right, everyone. He's the medical emergency room director and also the emergency room residency program director. We have with us Charlene Teeter, who is the trauma and ER manager here at Garden City Hospital. And we also have with us the director of the Garden City Hospital Emergency Services, Hamido Camaro, correct?
Yes.
Welcome, ladies and gentlemen. When you go into the emergency room and you are having a heart attack or you need some special services, what do you expect from the emergency department?
Well, we act quickly. We take it very seriously. When you're having a heart attack, just like as you previously discussed stroke, it's important that when you start having signs and symptoms, you come to the ER right away. One of the first things we do when you get here is we do an EKG so that we can see if you're having a cardiac event. We also have the technology now that we can be in contact with EMS before they even bring you in. They can send us an EKG so that we can be preparing if you are having a heart attack and we're going to take you to the cath lab. We can get the doctors in, get the room set up, get all those things done. So we want to get you treated as quickly as possible.
So what are the exact symptoms of having a heart attack? I know, sometimes people say I was sweating, just, heart palpitations, but I took a shower and I felt better. So how do you sort of talk to those people?
There's something called angina, that if your heart is under stress or you're exercising, it can come on when you're resting, that you may have, there's a blockage in your heart. Your arteries are constricting, they get plaque inside them, and then if you were to get a blood clot or something, that could really block the arteries. Symptoms are different in everybody. Women have different symptoms than men.
So tell us about the symptoms that are different in women than men.
Well, they can have the same symptoms, but a lot of times women might experience more heartburn kind of a sensation. They get diaphoretic, get kind of sweaty. Anybody can have pain going up into their jaw, can have pain down your left arm. You can have back pain. So there are a lot of different symptoms that you need to be concerned about. And if you're experiencing any of those, we want you to come to the ER as soon as you can because we want to do all those things that we said.
No, I was just going to ask Dr. Wen. I've heard of people coming into the ER and thinking they were having a heart attack, but it was just, a little bit of heartburn or what have you. So how are you able to differentiate, and should you try to?
We try not to. Our main focus is to always make sure that the patient is okay. We rather said it's okay, we don't think it's your heart, or it's okay, we need some further testing, than rather to miss it completely. So any symptom is concerning chest pain anywhere, any referral, even atypical symptoms that you may not experience on a normal basis, please, you're welcome to come. We rather say 100% of the time it's okay than it said you should have come.
There's a few incidences that have happened within the last couple of years that I personally know of, and people who are very healthy have absolutely no signs and maybe just doing some exercise and they have massive heart attacks. And unfortunately, what can people do in terms of being able to know whether they have heart symptoms? And I know with insurances it's very hard to have any of those analyses unless there's proof that it's needed. So how do people with those kinds of conditions have some information prior to something fatal happening?
We look at a lot of the risk factors. Same with the risk factor for stroke that we previously talked about. There's a smoking, cholesterol issue, high blood pressure, diabetes. Obviously, with those risk factors, you have an increased chance of having atherosclerotic disease and coronary artery disease, and subsequently heart attack. We take all those into factor. However, in my own experience, in my example, I have as young as 19-year-old having a massive heart attack and did not make it. And to me, the younger you are, the less chance that you will survive because you do not have any collateral blood flow to your heart. As if you are a little older, you tend to develop collaterals, blood supply, so you tend to survive a heart attack. Plus the fact that the younger you are, the more likely you will have atypical symptoms. Mm-hmm. And to be honest with you, those are the ones that I am concerned about, because if I have a patient that comes to me and said, "Doctor, I have a history of heart problem," it's easy for me. I already know, I know what testing to do, and we can go further. But it's the young one, like young man like Hamadou here come to me, no risk factor, no history, and says, "I have concern about my heart." He actually is considered low risk. However, in my clinical experience, he is the highest risk because I have no idea of what his history is. And in addition, he has probably undiagnosed risk factor that we don't know about. And he has more to lose if he truly have a heart attack because he has no collateral.
So you would be able to do the analysis.
Exactly. And we offer services. We have wonderful cardiology team here that our program that we actually admit them right to the hospital, right to the cardiology service. They're able to do the stress test, and with the addition of our cath lab that we can do emergently, urgently, and now electively, we can actually set them up to get the definitive test to really diagnose acute coronary syndrome.
Wonderful.
People who have hypertension, there are some black men very often will have undiagnosed cardiac histories and things, so those are some of the things he's talking about that you may not know about. A lot of people have high blood pressure and don't
Right,
take
the
their
risk factors or the genetic issue too.
Yes.
And it runs in the family as well.
Exactly.
Yes.
So, Hamido, talk to us about your department and what you're addressing at this point in terms of the emergency room.
Our department, we are here 24/7 for the community. We do offer all kind of services, and then things that are not done in the emergency room, we have consultations. We have services that we do consult. We are currently a level 3 trauma certified center. We are a stroke center. We do have a cardiac cath lab that we are open 24/7 for the needs of the community and the population. So we do everything in this emergency room, as small as it is. Our plea to the community is, if you having chest pain or you having any confusion, anything going on with you that you don't understand, please come to our ER. We are here to serve you. We are here to give you our services, and our doors are open to help you.
We were talking earlier that there's sort of a reconstruction in terms of the ER, being able to give that service, and also the time frame in terms of the wait. I mean, if someone is having a heart attack, or everyone feels that their situation is the most important. So what are you doing to address that issue?
We do not have a wait time in our emergency room.
That's what I like to hear.
We do not. I mean, some days we might get heavy days, where we have a lot of patients come to the emergency room at the same time. But our chest pain patients, our patients, they are like having higher priority patients, we see them quickly. Those are people that we just see them emergently. They don't wait. They don't have to worry about waiting in the lobby. They just come straight to the front. We get an EKG on them quickly, and then if there's anything based on the EKG or the lab work, we send them to the right place they need to go. Some people need to go to the cath lab. The cath lab, is 30 minutes, from our door to the cath lab, and we're gonna we always make sure that those people actually get there as quickly as possible, so we do not have a wait time.
And we have trained staff. Our nurses all are trained to prioritize people, so they know that people who come in with a heart attack or symptoms of a stroke or anything that would be.
And you have a team available.
Yes, and then we
to
have
address
other
it.
people that will take them right back and get them going. As Hamadou said, we don't make people that could have life-threatening or life-changing.
Aaron, please call
kinds of
3426. Aaron, 3426.
Again, we're in the hospital, so that's going to happen. Trauma, really quick, I wanted to talk about patients coming in who have experienced immense trauma in terms of car accidents, accidents that they've had. What kind of issues can you address in terms of not just the physical, but the emotional issue of
Well,
trauma?
we have social workers here in the ER that work with our staff. Our physicians and nurses are all trained in how to deal with the families and the patient themselves. We are a level 3 trauma center, so our EMS system in the community knows to take any, if they can get to a level 1 or 2 trauma center with a really severely injured person, that is what our protocol says to do. But we have people all the time that are very severely injured that come to us if they have airway difficulties, or if we're the closest facility and they're arresting or something like that, they will bring them to us. We can stabilize, and then we have transfer agreements with the surrounding level 1 and 2 trauma centers, so we will transfer them to a higher level of care. There's something called the golden hour in trauma, so we try to do it as quickly as we can to get them to that care. That's also why EMS would take them to a higher level of care.
Absolutely.
But we can stabilize anything, and we get people that don't come by EMS. Somebody will get a gunshot wound, and somebody will drive up to the door and go, "My friend shot in the car," and we bring them in and stabilize them. We can admit trauma. It just depends on, we have trauma surgeons on call 24 hours a day. We have an OR crew that will be here. So, we can even take people to surgery if we need to get them stable.
So Shar, there's a senior ER program here at Garden City Hospital. Tell us about that and what to expect.
Well, we have started a few months ago having a designated area that we can put our seniors in when they come in. Anybody that comes in that we think is having a heart attack or has been in
So
a trauma.
define senior. What?
Anybody above 55 years old. So I really take offense to that. But,
Okay.
but when they come in.
We better get those discounts.
That's right. That's right. We'll give you the little card. When you come in, if you're here for dizziness or something, and we do an EKG and we don't determine that it's cardiac in nature, it's a separate area that's quieter. We have big clocks. We have boards that we have special things that we can put on if you're hard of hearing and you forgot your hearing aid. We have reader glasses we can give you.
Wonderful.
We have special phones so that if you have family members somewhere else, they have 2 handsets, so the doctor can be on one and the patient can be on one, and we can be talking to family members who maybe are out of state or something. So we've tried to make accommodations for our seniors. We have special education that we give them. We also go out into the community and do some community education on not falling, because a lot of our fractured hips are elderly people who have fallen at home because they have rugs on the floor or whatever. So we give them a lot of tips about that. We have things on stroke and on our acute MIs if you're having a heart attack, the signs and symptoms. So just things that will help them to know what to be looking for. So we can give these out to people. And then we have these little pocket things that you can put
those
in
are for
your
the
car.
car that you
Yeah,
told
this
me
is for
about.
trauma, but you could also take it to your doctor's office that has your medications listed and your allergies and all that. So if you're in a car accident and you can't talk, then they'll look for this in your car and bring it with you. So these have magnets on the back, so seniors can just put them right on the refrigerator. And then
So
when EMS comes, they can just grab this and come, and if they're not able to tell us, because, my husband's on a lot of medicine, and I know remembering the doses and all that is hard when you're already stressed because what's happening. So EMS, we've been educating our EMS partners just to look for these and grab them and bring them. So we're trying to do some things to help our seniors so that when they come, it's quieter. We have dividers between each, like walls between each of the cubicles, so it's a little more private. Just
And stress actually,
Sure.
I think, induces more symptoms
Sure
that
it
may
does.
have not been there. So that's a wonderful,
Well,
wonderful
everybody's
addition.
anxious.
Sure.
If you're having something and you're not sure, am I having a heart attack or is this just indigestion? So, like they both
Wonderful.
said, we want them to come right away, and we'll have a special place to take care of them. When they first come in, if we think there is something critical, they will go to our main ER because that's where all our specialized equipment is. But over here, it's a quieter, more low-key atmosphere for our seniors, not so loud and so chaotic.
Wonderful. And then Dr. Wen takes care of them? And
He does.
Has it all under
That's
control?
right.
So thank you so much
Thank
for
you.
joining us. Thank
Thank
you,
you.
Shar.
Thank you for coming.
Thank you, Dr. Wen. And thank you all for joining us on WDHT TV. I hope you got some pertinent information, and please stay healthy out there.